Hello, I'm Allie Wentworth, and I'm so honored to be here talking to Deo and Paul Farmer on behalf of the Village Healthworks. And it is not lost on all of us the irony that we are in a global pandemic right now. One of the things, Paul, in the Netflix special, Bending the Arc, was a woman who was saying, "Rich or poor, we have the same blood." So here we are, COVID 19. So first of all, you guys are very good friends, aren't you? Brothers from another mother, as they say.
We definitely are. And we also think of our families as family. So it's not just the two of us.
And you met at
That's
Harvard.
right.
Can you tell me about the genesis of this incredible friendship?
I remember very well the day that I met Deo. He came to a class that I was giving at Harvard School of Public Health. And, we just started talking, and that conversation has now gone on for a couple decades. Obviously, it's
That's right.
involved, a lot of time together, working together in the United States, in Rwanda,
Mhm.
in Burundi, of course, but Deo's been to Haiti, knows the work that we're doing, and we've all been to Burundi, and our lives are intertwined in that way. It's been a very vibrant friendship.
I remember, Paul, that very same day we met, and I really felt that this person we met before in our previous lives, and it was such an uplifting moment for me when we met to actually see someone who even understand where I was born, the conditions, what I went through, the wars, and the kind of stuff, without having to ask, "Oh, really? Is there a country, Burundi? Oh, wow!" Stuff like that.
For someone like me who took my daughter to Burundi, having been there and seeing how incredible the Village Healthworks is, it's a struggle for me because I'm always trying to describe what all of you have created there. Obviously, when you get to actually smell it and feel it and see it and talk to the people, you get a much better example. But
Yes.
the holistic model that the Village Healthwork implements in Burundi is unusual nowadays because it's a specific scalable technology-based solutions. Those are the things that are so sexy and popular right now.
So you open a health center, and you have patients coming to get treated. So you really have to dig and look into the root causes of the problems. For example, a country of farmers, a country where you can grow anything you really you want, but you have 58% of the children in Burundi are suffering from malnutrition, and it's because of a lot of problems. So we kept integrating every program into our health program. And food, as Paul Farmer would tell you and has said that many times, food is a medicine. And really creating a space for people to have a conversation, do home visit with our community health workers to see exactly the living conditions they are in. So you can't really just do one thing in a poor resource setting like Burundi or Rwanda where PIH is, or even Haiti and can't, and then say, "Oh, I am just doing enough, and this is what is important."
When you show up, in the middle of a clinical desert, like Kigutu prior to Village Healthworks, people just have every kind of problem that you can imagine. Yeah, they're sick, but they're also hungry. They sustain injuries. And some of these illnesses, of course, are catastrophic illnesses and injuries: cancer, obstructed labor, AIDS, TB. But a majority of them are underpinned by poor nutrition. So, what should Village Healthworks do? Do you just shrug and say, "Hey, we're a medical organization," or do you design the organization to respond to the needs of the population you're serving? And Village Healthworks has chosen the latter,
Right.
and that's really Deo pushing forward a much more ambitious agenda than you're going to see in lots of parts of rural Africa.
One of the primary obstacles for Village Healthworks, there is the difficulty of delivering healthcare, and then there's a whole other mountain to climb with attracting donor dollars. How do you get people to think on a much bigger and global level when they think about healthcare?
Health is a sacred, and public health, medicine as such, healthcare system should be sacred. And we should really be able to invest as much as we can to make sure that no mother dies in childbirth in the 21st century.
Deo, how important is the teaching aspect of the new Kigutu Hospital?
So we really wanted to make sure that healthcare service is also going to train the future leaders in healthcare and and share the knowledge, not just where we are, but across Burundi. Go to other hospitals, public hospitals, and provide the quality of care, improve the quality of care in those hospitals and health centers.
The tasks of the teaching hospital are to teach, to do research, to generate new knowledge, and to provide care for patients. Everywhere that mission is followed, the quality of care tends to go up. And that's in large part, we believe, because of young people asking questions, participating, in other words, being trainees in a teaching hospital.
If there's one thing that we know for sure, it's the end of this life. And we don't want to take our knowledge into the grave. You need to leave that knowledge with others in the future generations who will learn and transfer the knowledge to other people and keep really expanding. That is the really goal for this hospital, to improve the quality of care in Burundi and also train young minds so that they can continue the mission, the vision, and improve to help those poor people who are neglected.
This is meant to be a world-class teaching facility that happens to be in rural Burundi. This is the epicenter and the home base of what will be a very large and influential program to address health disparities in Burundi and the region.
Exactly, yes. The government gave us a catchment area of 200,000 people today, but we see people crossing the Lake Tanganyika from Congo with the canoes. We see people coming from neighboring countries in Tanzania from Goma. So as Paul said, our doors are open for every human being who needs help, and we can help.
Right now, our whole world is in crisis, and it's very hard for people to be optimistic. Tell us how you are being so optimistic about the future of the Village Healthworks and what you can do in the future to provide healthcare for all these people.
Anybody who's been to Kigutu before there was even electricity or a safe water supply can't help but feel optimistic looking at how far things have come now. Even without the hospital completed, Village Healthworks is an epicenter of goodness and healing that reaches a very large area. When you invest substantial resources, including your own energy and passion, when you do that over time in this arena, people are optimistic because they see improvement. To get optimistic, get involved.
We find hope that keeps us going. It becomes this really honor to serve.
I want to thank you, Deo and Paul Farmer, for talking today, for being the incredible human beings that you are. And I hope that more and more people will support all these efforts and give to the Village Healthworks. So thank you.
Amen.